No one wants to lose their vision, but not everyone knows how to preserve and restore it. If you want to see clearly and sharply after 60, watch our video. You will learn how to improve your eyesight and stop the progression of glaucoma and cataracts. After the age of 60, 70% of people experience vision loss, and we can't turn back time. But there are proven ways to preserve your eyesight. Today you will learn what to do to see better. Today you will learn how to restore lost vision. Why is it useless to put Japanese vitamins in your eyes? What glasses should never be worn? What should you start doing today to see well tomorrow? What habits restore eye health? Why and how can eye drops be harmful? How to apply drops to your eyes correctly? What folk remedies can replace pharmacy medications? What do snipers do to restore their eyesight? And our expert will warn you against mistakes and explain how not to miss the early signs of cataracts and glaucoma, and will give you some valuable advice, more than one. I have one question for you. Does vision deteriorate with age for everyone? I'm sure you answered yes, but that's not true. Not everyone's vision worsens to a critical level. There are examples of people who maintain good eyesight even in old age. The famous artist Pablo Picasso painted until the day he died, and he lived to be 91. His vision declined with age, but only slightly, enough for him to continue doing what he loved. How did he manage that? And what should we do to see well at 90? Let's figure it out. Let's start with a simple problem that affects all elderly people and impacts vision. It's dry eye syndrome. The thing is, the quantity and quality of tear fluid decreases with age, and this fluid, like protective armor, should cover the surface of our eyes. Without this film, the eyes tire quickly, and you feel fatigue and burning, and that affects vision. The eye's resources are used up faster, and if you regularly watch our channel, you know that every organ has its own resource, and it's not infinite. So what do? We go to the pharmacy and buy drops for dryness, but some of them, as it turns out, can be addictive. How about that? But there is a category of drops that help the eyes and do no harm. Many specialists recommend using them after age 60. What are those medications? The advice comes from our expert, ophthalmologist, refractive and laser surgeon, Natalia Turygina. In such cases, it is recommended to consult an ophthalmologist, but before your visit to the doctor, you can start using moisturizing eye drops on your own. They come with or without preservatives. For long-term use, give preference to a natural, preservative-free product based on hyaluronic acid. This is a natural moisturizer for our tissues that effectively attracts water. Such drops can be used regularly and safely. And now, important information for those who choose drops on their own. If the ingredients include preservatives like borax, castor oil, boric acid, polyoxyethylene, chlorobutanol, disodium EDTA, do not use these drops. These preservatives are banned in Russia. In general, the fewer preservatives, even approved ones, the better for your eyes. So choose drops in single-use packaging. And for those who only trust folk remedies, in this video I'll tell you which ones are good for your eyes. In the meantime, let's recall one of them, aloe. In the Soviet Union, this remedy was used to treat eye conditions and restore vision. But now there's no point in dripping aloe juice into your eyes because it's already been proven that this treatment is extremely ineffective. There are much more effective remedies, and soon you'll learn what they are. But first, let's understand why we need to put anything in our eyes. What will it change, and what drops don't help at all? So, it's believed that vision can deteriorate due to a lack of vitamins A, C, and E, And the most common vision issue after age 60, cataracts, partially develops due to a deficiency in these vitamins. Let's ask the expert. Can vision really deteriorate due to a lack of vitamins A, C, and E? Is that true? Can replenishing vitamins improve vision? Vitamins A, C, and E are indeed very important for the eyes. Vitamin A is necessary for the production of rhodopsin, a pigment responsible for night vision. Vitamins C and E are antioxidants that protect the structures of the eye from oxidative stress. However, taking vitamins does not always improve vision or stop its decline. In the case of vitamin A deficiency, night blindness develops, and taking this vitamin will improve night vision and the overall condition of the eyes. But such a condition is rare. In other cases, when vision deteriorates either up close or, on the contrary, at a distance, taking vitamins does not affect these processes. Usually, antioxidants and vitamins are used to support eye health. These drops are prescribed for long-term use because they nourish and support the cornea, and not just the cornea. Most often, such products are used to prevent eye diseases and age-related macular degeneration, a condition in which the retina's cells gradually become damaged and stop functioning properly. We asked the expert, should antioxidants and vitamins for the eyes be used after age 60? I personally do not prescribe antioxidant eye drops to my patients because there is not a single large-scale study that has proven their effectiveness in the prevention or treatment of eye diseases. However, if you are using these drops and feel a positive effect on your vision, then, of course, there is nothing wrong with that. I wonder which products are dangerous to put into the eyes. As a doctor, I do not recommend using any substances that are not specifically intended for direct application to the conjunctival cavity or the surface of the eye. People often use honey, but it's important to understand that honey is a nutrient-rich medium for the growth of microorganisms. There are even patients who instill urine into their eyes, which can also cause eye inflammation. In cases of eyelid inflammation or styes, spitting into the eyes is another harmful practice. It won't help, and it can very likely cause harm. Do you remember when Japanese vitamin eye drops were heavily advertised? They're still being sold today. And I found out that drops with different vitamins don't work. But let's clarify, why is that? The thing is, our eyes are designed in such a way that nothing can get inside them. They're equipped with a powerful structure that doctors call the blood-ocular barrier. Simply put, it's a protective layer. It blocks anything you apply from the outside from entering the eye. That's why all the vitamins only affect the surface of the eye, the cornea, the eyelids, nothing more. The only exceptions are selenium and taurine, which can bypass the eye's barrier. Drops with these ingredients can be used, and you'll be surprised to learn that such drops are classified as dietary supplements, just like various tablets. For example, with bilberry. Do they help or not? Let's hear what the expert says. Supplements containing bilberry, selenium, and taurine are all biologically active additives, but not medications. They cannot cure anything. Among them, bilberry is the most popular supplement. Some of my patients have conducted personal experiments by taking a full course of each supplement, but their vision did not improve afterward. The use of supplements is recommended only in specific retinal diseases to help prevent progression. For example, in age-related macular degeneration, there is a study that shows that taking vitamins C, E, as well as zinc, copper, lutein, and zeaxanthin, which may help slow its progression. Do you agree with our expert? Share your opinion in the comments. Tell us, do you use supplements for your eyes? Maybe bilberry helped you. And I'll show you how to properly apply eye drops. It turns out not everyone knows how to do this. So here's the correct technique. Watch closely. Look up. This helps prevent your eyes from reflexively closing and allows the medicine to reach the mucous membrane. Pull down the lower eyelid. Do this with a clean hand, avoiding contact with the eye. Gently drop the solution into the lower eyelid. This area is called the conjunctival sac. Do not squeeze your eyelids shut to avoid the medication leaking out. Just gently close them. Stay in this position. Wait a little while so the medication spreads evenly across the eye surface. Now you know how to do it for maximum benefit. But remember, vitamins don't enter the eye even with the correct drop technique, yet they are still essential for your vision. Some studies show a direct connection between vitamin A deficiency and cataract development. This is a clouding of the eye's lens that makes vision blurry or hazy, like looking through fog. According to the World Health Organization, cataracts are one of the leading causes of blindness worldwide, and more than 50% of people over 80 have cataracts. That's every second person. Can cataracts be stopped at early stages? Although ophthalmologists sometimes recommend that patients use antioxidant eye drops, the official clinical guidelines in ophthalmology clearly state that there are no medications that can cure cataracts. The only effective method is surgical removal. However, if you have an early stage of cataract and surgery is not yet planned, while visual acuity remains relatively high, then using drops as a preventive measure is acceptable because there are no alternative treatments. Still, don't forget the importance of a healthy diet and protecting your eyes from ultraviolet or UV light, as these are also factors that influence the progression of the disease. It's scientifically proven that cataracts are irreversible without surgery, and all we can do to prevent or slow them down is to provide our eyes with enough B vitamins and omega-3. These are well-known antioxidants, substances that slow down cell aging. According to statistics, people who regularly get enough antioxidants are 40% less likely to develop cataracts, but those who consume a lot of sugar, more likely. There's an opinion that high sugar intake, and as a result, diabetes, lead to vision loss and increase the risk of cataracts. But why does vision decline in diabetes? With persistently high blood sugar levels that are not brought down to normal, damage occurs to the blood vessels of the retina. The capillaries become more fragile, microaneurysms develop, and fragile new blood vessels begin to grow. This leads to hemorrhages and fluid leakage from the capillaries. As a result, swelling can develop in the central part of the retina, which causes a decline in vision in patients suffering from diabetes. How can you improve vision that has already deteriorated? I recommend that all patients with diabetes visit an ophthalmologist at least once a year and also maintain normal blood glucose levels. In addition, it's important to monitor blood pressure to prevent retinal complications. If diabetic retinopathy begins to develop, the most effective treatment is retinal laser coagulation. In cases of diabetic macular edema, patients receive intraocular injections that block the growth of newly formed blood vessels. Maintaining normal blood glucose levels can indeed prevent further vision loss and even improve it if the damage isn't too serious. And of course, a healthy diet, physical activity, and quitting smoking can positively affect overall health and therefore vision, whether you have diabetes or not. We've prepared a guide with foods that contain vitamins beneficial for the eyes. Another issue affecting aging eyes is glaucoma. Glaucoma is often called the silent thief of sight. because it can develop without noticeable symptoms until significant damage to the optic nerve has already occurred. So how can you tell if you might have glaucoma in its early stages? Let's ask the expert. Glaucoma is a chronic condition that leads to damage of the optic nerve due to elevated intraocular pressure. How can the disease be detected at an early stage? It's nearly impossible to do so on your own. Only a few patients experience slight narrowing of the visual field, eye redness, rainbow halos when pressure rises, or a sensation of increased pressure in the eyes. When glaucoma is detected early, it is usually enough to prescribe eye drops to lower the pressure. However, since the listed symptoms occur rarely, the only reliable way to avoid missing the onset of glaucoma is to undergo regular eye exams with intraocular pressure measurement. Doctors use the Amsler grid for diagnosis. The person looks at the central point with one eye, and if lines appear distorted or disappear, that's a dangerous sign. Another red flag is poor vision and low light, an early sign of vitamin A deficiency or retinal dysfunction. Personally, I can't see well in the dark, but I always thought that was just a feature of my body. Could it really be an early sign of disease? This is indeed a valid reason to see an ophthalmologist, especially if poor night vision wasn't always present but has worsened recently. Such deterioration may be caused by a vitamin A deficiency, changes in the retina, or the development of cataracts. It's important to understand that there are irreversible vision problems that can't be corrected, and reversible ones that can be improved. And in the next part of our video, we'll explain how to improve eyesight when the issue is reversible. And here are some effective folk remedies and practices for eye health. Blueberry infusion. Pour 1 tablespoon of dried blueberries with a glass of boiling water and let it steep for 15 minutes. Drink every morning and evening. Calendula decoction. Pour boiling water over 1 teaspoon of calendula flowers and let it steep for 20 minutes. Use as eye drops. 2 drops twice a day is enough. Another interesting recipe includes carrot juice with olive oil. Why should you take carrots with oil? Because oil enhances the effect of vitamin A and nourishing the retina. Mix equal parts of carrot juice plus parsley plus spinach. Drink a glass every day. This drink contains lutein, beta-carotene, and vitamins. But does it really help? You can find different opinions online. Let's ask the expert how effective carrot juice actually is. Carrot and parsley juice are often promoted as remedies for improving vision, but whether that's really true is a big question. Of course, they contain a lot of vitamins and antioxidants that are beneficial for our overall health, including eye health. However, if there are organic changes in vision or eye diseases that reduce it, carrot and parsley juice cannot fix the problem. That said, if you have a vitamin deficiency, drinking these juices may indeed lead to an improvement in vision. Some believe that vitamin A really is beneficial for the retina, but it doesn't solve the problem of cataracts or glaucoma. As for eye compresses, they really do help relieve tension and inflammation and also reduce dryness. Many people know about tea compresses. Brew 2 teaspoons of good clean green tea, cool it down, and place it on the eyes for 10 minutes. It reduces puffiness and improves microcirculation. And our grandmothers used potato juice to relieve eye strain. Grate fresh potatoes, squeeze out the juice, soak cotton pads in it, and place them on your eyelids for 15 minutes. And now for some unusual recipes for eye health. Recognize this? Turmeric. This spice is recommended in almost every one of our videos. But what can we do if turmeric is so valuable for our health? It has anti-inflammatory properties, and in the case of the eyes, it helps prevent retinal damage. Add 1/4 teaspoon to warm milk with honey before bed. Saffron, another secret ingredient for your health. It can strengthen the retinal capillaries and improve vision in the early stages of cataracts. Here's the recipe. Brew 3 to 5 saffron stigmas in a cup of hot water. Add honey. Ginkgo biloba, which many of you take to improve memory, also helps increase blood flow not only to the brain, but also to the retina, protecting the eyes from age-related changes. What else can we do every day to preserve and restore our vision? Eat properly. Include eye-friendly foods in your diet. These are spinach, broccoli, blueberries, fatty fish, and nuts. Avoid sweets and foods with trans fats, which damage blood vessels and trigger inflammation. Eye mucosa protection is needed even with good vision, and even more so if there are problems. So remember this. First, air out the room regularly to prevent the eye mucosa from drying out. Second, use lamps with soft, warm light. Dim light makes the eyes strain, and bright light without diffusion causes photostress. Don't know what that is? I'll explain briefly. Look, when the lighting is too weak, our eyes try to catch detail and focus on what we see. This eye strain leads to fatigue and even headaches. On the other hand, bright light blinds us. As a result, we squint. How can you avoid photostress? Install soft and diffused lighting at home that allows your eyes to relax. Third, follow a healthy screen use schedule. There's a great rule, 20-20-20. Every 20 minutes, take a break and look at something 20 feet or 6 meters away for 20 seconds. This routine reduces eye strain, improves comfort, and helps prevent digital eye strain syndrome, which can occur due to prolonged screen use. And of course, don't forget eye exercises. Also include restorative eye exercises. We've created an eye exercise routine that includes training used by snipers, and it really works. Take a look. Exercise 1. The 8. Imagine a horizontal figure 8 at eye level. Move your eyes along the shape 10 times. Exercise 2. Crosses. Look up and down, then left and right. Repeat 10 times each. Exercise 3. Palming. Cover your eyes with your hands without applying pressure. Focus on the black background for 2 to 3 minutes, then remove your hands. This exercise relaxes the eye muscles. Eye exercises are helpful for relieving visual strain, especially if you spend a lot of time working on a computer or looking at your phone. However, you shouldn't expect them to restore vision in cases where there are underlying conditions like farsightedness or nearsightedness. If you work at a computer, at the very least, take frequent breaks. After every 20 minutes of work, shift your gaze into the distance for 20 seconds. This allows your eyes to rest. I hope you understand that eye exercises do not cure glaucoma. Glaucoma is associated with increased intraocular pressure and requires medical treatment. Treating glaucoma with eye exercises is like trying to fix a broken leg with massage. Massage may relax the muscles, but it won't heal the bone. Same goes for glaucoma. Pinhole glasses or glasses with perforations also won't help with glaucoma or cataracts. According to doctors, such glasses are complete nonsense. Even though they are sold in optical stores, you should not wear these glasses. That's because your vision doesn't actually change. At the moment you're wearing them, you squint and see a bit better, but that's not even a temporary effect. It's pure self-deception. Instead of using useless perforated glasses, it's better to do exercises that involve focusing your eyes on objects at different distances. There's a focusing technique called the window method. First, look at an object nearby, then shift your gaze to something outside the window, about 10 centimeters away. Repeat 15 times. We also found another vision method used by the Japanese. Press your index fingers to your temples, gently lifting the skin. Squint slightly and then relax. Repeat 10 times. This stimulates blood circulation. Now it's time to talk about eye yoga. Think it doesn't exist? It actually does. Some well-known poses can improve blood circulation in the head area and therefore supply the eyes with nutrients. Can you guess what those poses are? They're downward facing dog and plow pose. Include them in your morning routine if you want to preserve and restore your vision. You do understand that regular exercise is essential for people over 60, right? It benefits muscles, circulation, and joints. By the way, we're soon releasing a video about joints, in which our experts will answer your questions. Ask them right now in the comments. And to make sure you don't miss advice from our new expert, subscribe to the channel and be sure to click the bell next to the subscribe button and select all. That way, you'll get notified and won't miss the new episode. But let's continue. In addition to yoga, there's also a special breathing technique that helps reduce intraocular pressure. Look, it's simple. Close your eyes and take a slow breath through your nose over a count of 4. Then hold your breath for 6 to 8 seconds and exhale over a count of 8. Of course, both breathing techniques and exercises must be done regularly. The so-called silver age, the years after 60, requires a systematic approach to health. It's better and healthier to do even just one exercise every day than to do them all once a month. It's also important to visit your ophthalmologist regularly. Our expert shares tips on how to find a good doctor. I recommend reading reviews about the doctor, making sure they have a relevant medical education and are regularly advancing their qualifications. The doctor should also work with modern, high-quality equipment that allows for the detection of subtle eye structure details and early-stage diseases. And one more thing. You should feel comfortable with your doctor. You should like them as a person. A good doctor must be empathetic and kind, not raise their voice or blame the patient. Medicine can help even in the most hopeless cases, but it's important to remember that prevention is the first step to health. Don't forget to take breaks while watching videos on your computer or phone. Wear sunglasses outdoors and monitor the lighting in your home. Proper nutrition and caring for your eyes can help you see clearly even after 60, and that's exactly what we wish for you. That's all for now. Take care of your eyes today so you can enjoy the beauty of sight tomorrow. Subscribe to our channel and get more helpful tips from our experts. And write your questions for our joint disease experts in the comments right now. Wishing you health and longevity.